What are gallstones and where do they exactly form?
Developing inside the biliary tract. Biliary tract comprises of bile ducts which are either inside the liver or outside the liver.
So what are the reasons? Is it like food, cholesterol, oil, grease, or genes? What do we blame?
So there is no basically single factor for that. So basically gallstone can happen in any age, in any gender.
What are the early signs of gallstone? Like most of us will develop some or the other pain sometimes if you eat a heavy.
But if the pain doesn't settle with the mild painkillers, then definitely you should go to the hospital and then get it checked immediately. But it is a classical symptom is present only in 50 to 60% of the patients. 40 to 50% of the patient may not have the classical symptoms. They might have just a discomfort, just heaviness.
Namaste everyone. Welcome to one more episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a platform where we discuss health in simple language by experts in the field. Have you ever developed sharp pain in your stomach, especially on the right side after a heavy meal? It can be gallstone. What are gallstones? What are the reasons for gallstone? What are the myths related to gallstones? To clear this confusion, I am very happy I am joined by Dr. Manish Madan, who is a renowned gastrosurgeon, has been dealing with gallstone for years together. He is going to clarify all the confusion related to gallstone, myths related to gallstone. He is going to share with us what are the sensible treatment options, when do you go for medical treatment and when is surgery essential. He is going to clarify all this today, and wait till the end because we will have a rapid fire questions at the end. Thank you, Dr. Manish, for accepting our invitation and be a guest on our podcast. Dr. Manish, for viewers' understanding, can you tell our viewers what is your background?
So thank you for inviting me, and this is a very good platform for creating an awareness in a sensible way with experts rather than going to the people who do not have any idea about what they are talking. So I'm a gastrointestinal surgeon. I belong to Ahmedabad, India. I have worked in India, Bahrain and UAE, and then I have been settled here for last 4 years, and I have vast experience in minimal invasive surgeries and laparoscopic surgeries, which is my passion. And today's topic is something which we deal on day-to-day basis very routinely, and I'm happy that you have selected this kind of a topic which is very pertinent to the public, and it will be helpful for them. Thank you.
Thank you, Dr. Manish. So let's start simple. What are gallstone and where do they exactly form?
So basically gallstone is a term used for anything which is a hard deposit which is developing inside the biliary tract. Biliary tract comprises of bile ducts which are either inside the liver or outside the liver, and also the gallbladder. So most of these gallstones are formed in the gallbladder itself. 95 to 98% of the gallstones are formed in the gallbladder itself. Very few can develop outside the gallbladder in the biliary tree.
Right. So one thing which is observed is many times it is detected incidentally. So why do they stay silent for such a long time?
So basically, unless they will block the passage of bile which is coming out from the gallbladder, it will not create any symptom. They will stay silent for lifelong. There are post-mortem studies which is like in the medical literature, many of the patients, up to 9% of the population incidence is there, which means not everybody who has gallstones will develop symptoms, and not everybody will require treatment for that as well.
So maybe quite often you must be seeing incidentally detected gallstones.
True.
During some other checkup. Yeah?
Yes.
So that is quite. So what are the reasons? Is it like food, cholesterol, oil, grease, or genes? What do we blame?
So there is no basically single factor for that. There are many reasons for that. The most common mechanism of the gallstone development is when the gallbladder is full of the bile, which is very concentrated in cholesterol. The bile is formed in the liver. So liver is trying to get rid of the extra cholesterol from your blood, and it is filtering it very well. So liver is commendable organ, then it is removing the toxins and other chemicals through the bile.
Right.
Apart from that, when the gallbladder is not functioning properly, it is not able to pump it out properly, then actually the gallstones do form because of the deposit and the stickiness of the bile. Third mechanism is the infection. Whenever there is any minor infection in the biliary tree, in the gallbladder itself, that will provide, the bacteria will provide the nidus of stone formation. So these are the main mechanisms. Apart from that, obesity, rapid weight loss, rapid weight gain, hormones, hormonal treatments, oral contraceptive pills, and there are certain other reasons which can have the impact on the gallstone formation.
So many a times, like say for metabolic syndrome, we have a certain patient profile in mind. So is there any typical patient profile for someone who may develop gallstone in future?
So basically, gallstone can happen in any age, in any gender. There is no particular profile, but yes, in previous times in the medical school, we used to learn a mnemonic which is 4 Fs, which is standing for fat, fertile, forty, and flatulent, and fair. So that becomes actually 5 Fs. So females of the reproductive age group who are into their cycles, and then either whether they have been pregnant before or they are taking any oral contraceptive pills, they can have more chances of developing gallstones. But as the age increases, after the age of 60 say, the gender bias is not there in the gallstone formation. And also the gallstone can be of 2 types. Mostly they are cholesterol stones. What mnemonic suggests is about the cholesterol stones, but the pigment stones, it is happening in the early childhood because they are associated with the blood dyscrasias like sickle cell anemia or siderocytosis or something where the red blood cells of the blood component, they are destroyed rapidly and they will release the pigment of this bilirubin, which will again excess bilirubin in the bile will have the implication of the gallstone formation. These are called pigmentous stones. They are more harder. They are not amenable to any dissolving therapies. That is one reason to understand that dissolving therapies do not work always, because there were certain types of stones which will not be effective treatment for them is available.
So this the saying of fat, fertile, female, is it still relevant today, or it's something
Not exactly.
lot more than that? Yeah.
Not exactly. As we discussed, is basically any age, any gender can develop. The youngest patient I had operated for gallstone was 4 years old. And the oldest age I had operated was 94 years old. So basically there is a vast span of age duration, and apart from that, any gender can develop.
Is there any geographical predisposition, like something like say in India, whether North India has more, South India has less, or other way around? Is there anything like anywhere, or whether in UAE or anywhere?
So basically now it is very common. Alone in US, say 750,000 gallbladders are removed for gallstones every year. So that is the size of a population of one state of Uttar Pradesh in India. So we can understand how common incidence is there. But yes, North India has little more higher incidence of gallstone formation, typically which is on the belt of Ganga river. So diet, genetics, chemical exposure through the in the North India industrial areas or whatever, that can also have an implication, but it is not bonding is not, association is not very well known about that.
And nowadays people are traveling everywhere, so it may not stay relevant completely, although it may. Now then, what are the early signs of gallstone? Like most of us will develop some or the other pain sometimes if you eat a heavy meal. So when do we say it may be just a gas, and when do you strongly feel that this may be a gallstone and you should visit the expert?
So basically any heaviness after the meal which is starting to develop 30 to 60 minutes post meal.
30 to 60 minutes.
Yes. And then it is mostly located in the right upper part of the abdomen or the pit of the stomach, or sometimes the pain which is severe and radiating to the back or the right shoulder or between the two shoulder blades. These are the typical features of the gallstone pain, which is called biliary colic in the medical terminology. But it is a classical symptom is present only in 50 to 60% of the patients. 40 to 50% of the patient may not have the classical symptoms. They might have just a discomfort, just heaviness, just feeling like heartburn or acidity or indigestion, but it will not go away with the regular medicines for them. So that is one thing. When you are taking medicine and it is not helping to relieve your pain or discomfort or indigestion, then it's a good idea to check it, because gallstones can be there.
So then if someone comes with a pain, how do you, like clinically, of course there are investigation to confirm, but how do you clinically say whether this is just a simple acidity, gas, or is it possible to differentiate just by clinical examination?
Yeah, so clinical examination, again, it's specific but not very sensitive. So in the cases where there are no complications, it will not be easy to pick them up with the clinical examination only or the history taking only. But yes, what we discuss, if the typical features are present, we can be sure that there would be a gallstone component in that patient. Sometimes the two things like gastroesophageal reflux disease or gallstones or indigestion, they can be overlapping and then may be present in the same patient altogether. Apart from that, when there is a complication like typical right upper abdominal pain and tenderness, which is like a painful to touch area, the patient is not able to move, difficulty in breathing, and yellowish urine or yellow of the white of the eye, that happens, that is the indication of the complication. Then it can be more confirmative. The clinical findings itself can suggest that the complication is there.
Correct. Now, yes, of course, you described how you suspect clinically. Now, if someone had a nice dinner and he developed pain, should he immediately rush to the hospital, or should he wait for some time and then take a call?
So basically, if you are not diagnosed case of gallstones and then this is happening to you first time, maybe you can just take some painkiller routinely available, which is like paracetamol of, these kind of milder painkillers. And then if the pain goes away, you can get it checked based, on your convenience rather to leave it alone. But if the pain doesn't settle with the mild painkillers, then definitely you should go to the hospital and then get it checked immediately.
Correct. So need not rush immediately, but they should wait. And if it is not settling down, then there is then there is no reason to holding it back. Then I got it. So when a patient comes to you with the typical symptoms, and as you said, 50 to 60% of the time they will have typical symptoms, remaining may not have. So then how do you diagnose or confirm whether someone has gallstone? A simple ultrasound is enough, or you need more fancier investigations?
So ultrasound is enough in 95% of the cases. Any medical test, we have to understand, is never 100% accurate, never 100% specific, and never 100% sensitive for the matter of fact. So yes, but ultrasound is the investigation of choice because it is without radiation, it is easily available, the cost is less, and the simple screening ultrasound in the fasting state, which is more important to understand that.
Fasting state.
Yeah, because in the fasting state, gallbladder will distend and any gallstones will be easily visible in that area and in that condition. So ultrasound is effective. 95% of the cases we can rely on that. If there is a strong suspicion of gallstone and ultrasound could not detect, then there are certain fancier investigations like MRCP, which is kind of an MRI. Then we have HIDA scan, which is basically a proton kind of a thing, which is like I'll not go into the details of that, but there is some specific investigations available which can detect the gallstones.
Now you said it should be done in fasting condition, but the pain is after food, or many a times you may have seen the patient immediately after food. So then do they need to repeat ultrasound or anything like that?
No, as I said, I'm in fasting state for the elective cases, like the patient who came to OPD for the assessment, and then we can advise them to do the fasting and do the ultrasound. But if it is something emergency, definitely the same time the ultrasound will be done, and then if not detected on that ultrasound and if the clinical suspicion is very high, we may have to repeat the ultrasound after some hours of fasting.
I understood. Now you diagnose someone with gallstone. Is there a medical treatment or is it always a surgery? What is the first line of treatment you offer, and how do you decide?
So not everyone deserves surgery. We have to understand there are three categories of patients. One category which is clearly asymptomatic without having any classical symptoms or any dyspepsia, indigestion, gas, bloating or pain or anything. And they found out incidentally that there were gallstones on some unrelevant reasons for ultrasound was done, and then they found out the gallstones are there. But in this category again, there are two subsections. One, the asymptomatic patients with high risk features, like if they are diabetic, if their stone size is more than 3 centimeter in size, if their stones are multiple and very small in size, if they are someone who are on immunosuppression, like transplant patients or some rheumatoid patients which are taking regularly these kind of medicines, if they are like going to go for weight loss programs like bariatric surgery or weight loss surgery, or apart from that, nowadays the weight loss medicines are available vastly. So in those category of patients, again, it is a tailor-made decision to decide whether the surgery is required or not. Asymptomatic without high risk, definitely no. Asymptomatic with high risk features, we can consider. The symptomatic patients who have had typical symptoms of gallstone, biliary colic pain or other symptoms or complications any time in life, they definitely need a surgery. There is no doubt about it. Now, apart from surgery, what options are available? We have to understand that the medical treatment is available, but it is only reserved for the patients who are not fit for surgery. Why? There are multiple reasons for that. One, these are effective only in 30 to 40% of the cases. Second, they have to be taken for the longer duration, 6 to 18 months is the average time. Third, the recurrence is very common once you stop the medicine after even the dissolution happened. Maybe within 5 years, the chance of getting the gallstone back is 50%. Fourth, it will have their own side effects. 5, when you are dissolving the stones with this medical treatment, they will shrink in size, and then the chances of them dropping down through the bile duct and causing the blockage of pancreatic duct or bile duct causing jaundice or pancreatitis are very high. So this is the reason I do not recommend a medical treatment in any case unless the patient is absolutely unfit for surgery or anesthesia. Apart from that, if the patient is fit for surgery, they should go for surgery. If they do not want to go for surgery, they can wait and watch and observe. But it is not advisable because the rate of complication is around 2 to 10% every year in a symptomatic patient.
Okay.
That means, if a patient who has gallstone and symptoms, if we have 100 patients like that, minimum 2, maximum 10 patients every year land up in the ER. So that's a very high incidence of risk.
Since you have seen such huge number of patients and you have seen all profiles of patients, you definitely know and you can advise. You are in a better position to advise to the patient. But many a times we do come across the social media videos, whether it is YouTube or WhatsApp University, where you take apple juice and flush out, take olive oil and flush out. So is there any sense in any of those videos, say even for a small stones which is asymptomatic and incidentally detected? So what is your suggestion for someone who probably get carried away with such videos on social media?
So basically, this is where the podcasts like these come into handy, and they are helpful because you are talking with the expert. I don't want to create enemies online. I'm not going to say that these methods are absolutely nonsense or not useful. I'll not say that because I'm not the expert of that. That is one thing. But what I can say from my experience, basically the pathophysiology and the mechanism, how the gallstones form and how they behave and what is the natural history, which we have discussed in previous questions.
Right.
We can understand that gallstones are basically forming because gallbladder is not moving. Cholesterol or the bilirubin component of the bile is very high. Now you have to target two things. With these options of the non-surgical like olive oil or whatever, they are called saponified diet. They are basically trying to dissolve the cholesterol component of the stone, which is similar to the medical management which we are using, like ursodeoxycholic acid or the bile salts and everything. So in that case, it will be effective only in 30 to 40% as we've seen, because not all the stones will be cholesterol stones, and not every stone will have only cholesterol. They will have the other components like calcium, bilirubin and other pigments and everything. Second, while doing so, you are trying to stimulate the gallbladder, which will increase the chances of complication if you are already having the gallstones.
Right.
So I have seen patients landing up in the complication and the emergency room because of these kind of crash diets or some dissolving herbal medicines and all this. So at the best, I would advise not to use them. Correct. Rather than believing in everything which is available on social media. Go to the expert and rectify your myths.
Yeah. So viewers, doctors like Dr. Manish, who is expert in this field, has seen all types of complications related to gallstones, and many a times they land into complications because they follow some unverified advice from non-experts. So even if you want to consider any such treatment, my or Dr. Manish strong advice is to take the expert in confidence before actually considering such treatment, whether it is really useful. They may have some medical alternative options if you do not want to go for surgery immediately, but don't go for any non-verified advice which may cause some problem in the future. Now coming to our next question, Dr. Manish, when does surgery becomes like must, like you can't it's not like it's non-negotiable?
So we discussed previously like third category of patients who are symptomatic, or they have had complication, or they are already going through the complication.
Right.
There is no other choice. So when the patient comes to the OPD, based on the category of the patient, either asymptomatic without high risk, asymptomatic with high risk, or symptomatic or with had a complication. So the surgical advice, like what we do in our clinic is basically informed decision. Patient is a partner in the decision making. But when the symptoms are there, complications are there, we tell from our side because it's backed by the scientific literature.
Right.
So it's a clinical indication to go for surgery.
Yeah. So thank you again for clarifying. Now next question probably patient must be asking you is, what will happen if my gallbladder is removed and how will I be able to live a normal life? Now obviously it's a but natural question. One organ from your body which has been important for metabolism, digestion, all these years we are removing. So what is your advice to them who is probably panicking when you tell them that, yeah, I'm going to remove your gallbladder and you will be living without gallbladder rest of your life?
So if you go out and you don't know which person has gallbladder removed, so maybe 3 out of 10 people they would have a gallbladder already removed in adult population. Gallbladder is a tiny organ, it's a storage organ, it is not the organ which forms bile. Bile is required for the digestion, which is formed by the liver. So as soon as gallbladder is taken out, bile is still formed in the liver and then it is trickling in the intestines directly.
Okay.
The only change for the initial few days to few weeks which happens is body is trying to adapt to that continuous bile flow inside the intestine.
Correct.
So some patients can have post-cholecystectomy diarrhea or increased frequency of stools, some discomfort with the especially fatty meals. So that is why we advise after the surgery up to 2 to 4 weeks, they should not be having any fatty food. After that, they can resume their normal food. Digestion is not at all affected. There are no long-term consequences. There are no long-term complications without the gallbladder. People can stay absolutely normal throughout the life without this.
So then if a gallbladder is removed, will there be any changes for future, I am talking about, in their diet, energy, overall lifestyle, and how many weeks after surgery will it take for them to get it to the normal?
So any
normal
adaptation in the body generally takes 4 to 6 weeks.
4 to 6 weeks, okay.
And long term, as I said before, there are no consequences. There are no like this myth about having affected the energy levels, or sometimes people feel that they will gain weight or lose weight because the gallbladder was taken out. Right. It is not so.
It's a myth.
It's a myth.
Thank you again for clarifying. Now when it comes to surgery, there are 2 options for surgery, as most of us know. One is open surgery, where traditionally, even when we were studying, we used to see a long scar in the right side of the stomach. We used to know this is the gallbladder removed. So we do still see those scars, but and then the other is keyhole surgery. So how do you decide which option is best for the patient after the checkup?
So the keyhole surgery is the gold standard treatment. Nobody offers the open surgery nowadays. Open surgery is kept as a backup plan when we are doing the surgery and something wrong happens or something challenging comes up during the surgery. So it is a wise decision to convert it to open and keep the patient safe. So it is not a complication as such, but it is kind of a backup plan, you can say plan B. But yes, 100% of the times, not even 99% of the times, laparoscopic surgery is offered as the method.
That is the, like nowadays, that is the default surgery,
yes.
Which standard of care. Only if he is not suitable due to some reason or challenging time during the keyhole surgery, you go for open gallbladder surgery. Yeah, thank you very much again for clarifying. Now, how do we prevent these stones then? For someone who never had stones, he is not even aware about whether he is at a risk for stone. So, are there any food habits or any lifestyle habits which can modify the risk?
Overall, any healthy lifestyle will prevent lot of complications which are related to health. Gallstone is one of them.
Correct.
If you have very good fiber diet, high fiber diet, which is whereas we were talking about the North India versus South India,
Right.
because of the rice, lentils and all the overconsumption of that, because they are consuming more fibers, less saturated fats and moderate amount of fats. Absolutely zero amount of fat will also actually increase the chance of developing gallstones, because the gallbladder will not have the stimulation of pumping it out. Coffee is one of the thing which is considered to be protective for the liver diseases and gallstone formation. So if you are like fond of
drinker, yeah.
yes.
Yeah.
So if you are fond of coffee and then you are taking it regularly in moderate amounts, so these things and the physical activity, staying active, that can help to certain extent not to develop the gallstone, but it's not something that you will never develop a gallstone because you are following all this. Still it can happen.
Yeah. So now if someone with a heavy meal or whatever type of food he is eating, if he's at a higher risk for developing gallstone, then doing a crash diet or skipping meals, which is again an internet information probably for most of the people, will it help in reducing gallstone?
No, it will actually
Very
harm.
important, yeah.
So as we mentioned earlier, if you try to lose weight faster, if you are not taking the enough amount of fats in your diet, if you are not taking enough fibers in your diet, actually it is more risky.
So it is absolutely no for
Yes.
to avoid. Okay. So you have been seeing all types of patients in OPD. So what is the biggest myth you have seen about gallstone in all these years?
Mostly whatever we discussed there, these are the common questions. Apart from that, patients have like whether they are genetic or no. So
Genetic work. Yeah.
it is not genetic as such, but yeah, it is found in family members of like first or second degree relatives commonly. So we can say there is some component, but it is not genetic. It is not inherited basically. So it doesn't mean that you will pass on to your progeny for that matter. Apart from that, I think we have discussed all the myths and facts about that.
Yeah. So if someone is watching this video for the first time and he has digestive problems, maybe gallstone, may not be gallstone. So what is one advice you will give them today which they should start following from today now onwards?
If their lifestyle is at fault, fix it first. If it is fixed and still you are having some symptoms which are not controlled with the regular medication, please go and check with the consultant or specialist of that subject matter experts. It is not something you should take it lightly.
Correct.
And a simple ultrasound can help you diagnose the gallstones.
Yeah, and since you have seen these gallstones in all types of people, young people, old people, male, female, South India, North India, everywhere. So you should just go and get it checked up. Yeah. Yeah, thank you very much for swiftly answering all our questions in part 1. Now this brings us to the end of part 1, and then we will go to part 2, which is a rapid fire round, in which I'll ask you questions and we just want a one letter or yes or no type of answer. So are you ready for that?
Sure.
Yeah. Can gallstones cause cancer?
Yes.
What is the most common age group?
40 to 60.
40 to 60. Are gallstones hereditary?
No.
No. Good. Can children get gallstones?
Yes.
Yes. Is gallbladder removal a major surgery today?
No.
No, that's reassuring. Do gallstones always cause pain?
No.
Can homeopathy or any alternative treatment dissolve gallstone?
Partially.
Partially. Okay. So it should be under supervision. Yeah. Should every gallstone patient go under the knife?
No.
No. Thank you. Can stones return after the gallbladder is removed?
Yes, but not in the gallbladder. Gallbladder is only one.
Yeah.
It can happen in the biliary tree, which is less than 1% or 2% likelihood. It happens in specific diseases of the blood disorders, as we discussed, sickle cell anemia or hereditary spherocytosis and other some geographical areas which are having the bile duct stones. They are not basically forming in the gallbladder.
Correct. So then what do we do in those cases?
It's a very complex subject to discuss,
Yeah, maybe
but again, they need clearance. So there are multiple ways, endoscopic ways and percutaneous ways, and then major surgeries are available for them to help those patients.
Thank God it's rare after the
Yes.
surgery. Yeah. And what is the biggest dietary culprit?
Fatty food?
Fatty food. It's not just for gallstone, it's for diabetes, it's for so many other heart disease, kidney disease, for almost all. So fatty food should be avoided. Yeah, this comes to the end of this interesting and very informative podcast. I learned so many aspects about gallstones today. So thank you, Dr. Manish, for clarifying everything. And in simple language, I hope all of you have been able to understand this. So what I learned today is it's not always giving you symptoms. So it can be without symptoms. At the same time, not all gallbladder will need a surgery. We can still manage without surgery. But yes, of course, if it need arises. But the only person who can take the decision is the expert in the field. So always, if you develop this pain after severe pain, especially on the right side after food which is not settling down easily, take an expert's opinion. If you have any doubts or questions related to today's discussion, please do write it in the comments. We'll be very happy to answer those questions. If you want any specific topic, Dr. Manish want to discuss in future, please do write. We'll request him, and according to his availability, we'll try to arrange one more topic for discussion in the future. Remember, prevention is better than the treatment. Stay healthy. This is me and Dr. Manish signing off from today's episode. Have a nice day ahead.
Thank you.
Dr. Manish.